Today I want to discuss the deep lift and the difference it has compared to my work philosophy. First of all, the deep lift I want to emphasize is a completely standardized technique performed by excellent surgeons, many of whom are also my friends, so nothing to say about the technique. It is not my work philosophy, and in the scientific field, there is a significant debate about the necessity for a deep lift and instead the option to perform much less invasive procedures. Well, my philosophy is precisely to have minimal invasiveness. That's why I standardized the endoscopic technique and also for the neck a less invasive method. The deep lift is a procedure that involves a very deep detachment of tissues, thus in deep anatomical planes. This obviously means that long scars are necessary, surgical times are a bit longer, and patients, in my opinion, are exposed to greater complications. This without being balanced by a better effect compared to a less invasive or endoscopic lift. And especially many studies now show that there isn't even a difference in the duration of the procedures over time. So personally, I do not perform the deep lift procedure. I consider it an excessively aggressive surgical procedure without providing in return better and more long-lasting results over time. The deep lift procedure mainly concerns the middle third and the lower third of the face, so the neck and middle third, and it practically has no effect on the upper part of the face. Whereas, as we know, endoscopic surgical procedures, the Meval technique that I have standardized and which for me is the queen technique in facial rejuvenation, deals with the upper and mid third. So endoscopic surgery can work in this part of the face, and in this part of the face, for me, repositioning with vectors is fundamental. Vertical and also the restoration of volumes and the regeneration of tissues through the cephalar technique. As for the neck area, I also do not like to treat the patient in this region with overly invasive treatments. So, deep lift, and for this reason, I have standardized and published the NAL technique, which involves repositioning the platysma muscle in a minimal way, using polytetrafluoroethylene bands in a minimally invasive manner. Well, I hope I have made you understand my thoughts on the deep lift technique, which is a very excellent and effective technique performed by skilled surgeons, but one that I do not endorse because I do not want to subject patients to such heavy and high-risk procedures, which I find unnecessary, without giving them real benefits. Additionally, with the endoscopic technique, I can work on the upper third, use vertical vectors, not posterior vectors, vertical anti-gravitational vectors, minimal incisions because endoscopy involves small cuts, and for the lower part, ensuring precision, so neck platysma, the NAL technique also involves a superficial procedure here, not a deep one, ensuring minimal invasiveness, but it ensures stability thanks to these artificial ligaments.